douche with Clorox. Dr. Eric, who is doing his resident cardiology, and he comes from a family whose father is a cardiologist back east. Doc, every year we see people who are older, and they try to do a marathon in San Francisco, in this case, from the Bay to the Breakers, and this year we had a guy who they thought was dead. He was lucky that they were able to get him to the hospital. We still don't know his condition. What practical tips could you tell people who go out on these charity walks, these marathons, and that sort of thing? And you're going to Boston, and you'll see the Boston Marathon.
Absolutely. So we see this very often, as it's been occurring with multiple marathons been occurring in the last couple of years. Chicago and also Boston recently had some deaths as well. Some of these we can't predict because they do occur in younger populations that have no known cardiovascular disease, and a lot of these are trained athletes and still unfortunately undergo these terrible end result events. However, for the untrained athlete, I think the bottom line is competitive racing, especially any exercise that is unusual for the patient, is usually not advised unless there has been a significant training period beforehand. So really, these marathons are for trained athletes, and for people who are not trained athletes, they should be undergoing at least a formal program for several months up to the point that can condition themselves. The other important thing is the racing environment. So a lot of times the weather is very hot, and that also precipitates a lot of these events, either whether they're just revivable events or actually terminal events. But staying hydrated, trying to stay out of very warm weather when you're exerting yourself to a point that's above and beyond your usual conditioning.
One quick question. We always see the African runners usually win. Are they more, shall we say, healthy, speaking from a cardiovascular situation perspective?
Yeah. I'm not sure if there's anything genetically or structurally different about a lot of the African runners. They just tend to be very skilled athletes. So, but it is an unusual pattern, and they definitely tend to win most races. So, yeah.
Okay. Thanks, Doc.
Absolutely.
I hope people take your advice and we have less medical problems.
Thank you.
Okay.